Hello everyone! Welcome back, and as you can see, special set na naman tayo because we have more questions that require derma answers. And as you can see, we are again in San Fernando, Pampanga. And pag San Fernando, Pampanga, sino pa ba ang dermatologist na pupuntahan natin, diba? Si Doc Ailynne!
Hey! Welcome to Pampanga again!
Thank you, Doc! How have you been?
I'm always fabulous, blessed, and beautiful.
Yes! So this time, Doc, parang I wanted to go a little bit deeper into yung mga needs talaga ng audience. Kasi, Doc, mabusisi na sila when it comes to their skincare.
Which is very good, di ba?
Yeah, super, Doc. Ngayon, medyo marunong na sila tumingin ng ingredients lists. And actually, Doc, yun yung gusto kong i-discuss sa video na to. Specifically, anti-acne ingredients. Kasi it could be overwhelming for us to figure out kung ano ba talaga yung pinaka-okay for acne. We get caught up. Like, whenever pumunta tayo sa supermarket, ang daming nakasabi na anti-acne. Meron ako, Doc, na ginawang parang tier list or ranking list for us to be able to kind of rank ano ba yung dapat i-prioritize natin as anti-acne ingredients versus those na baka probably overhyped sila ng mga consumers or possibly it lacks evidence.
Yep.
First one, yung gold standard. Yung parang pinaka first line talagang binibigay ng mga dermatologists, yung pinaka recommended nila, and the ones that have a lot of evidence behind them talaga. And then yung second one, Doc, is what we would call probably second line, something that you would use as an alternative. And then we also have yung supporting ingredient, which is hindi siya something that would be prescribed on your first visit to the dermatologist, but it could be used to support an anti-acne routine. And then yung last one, Doc, is what we call lacking evidence. So I'm sure, Doc, as an expert on the skin, talagang science ang basis natin, di ba? Of course, evidence talaga. So itong tier na to is for those ingredients na parang medyo kulang-kulang yung evidence niya and it might not be something na dapat nating i-prioritize sa isang skincare routine. So this is just to better inform you as a consumer so you can make better skincare decisions for yourselves, especially for those na nagsastruggle talaga with acne. But at the end of the day, it's really still best to consult with a board-certified dermatologist. So hindi to replacement for medical advice ha. Kailangan pa rin kayo mag-consult with a dermatologist. And remember, especially for acne, there is no one-size-fits-all na treatment. So that being said, actually, yung no one-size-fits-all na treatment, ang ganda rin for us to revisit, Doc. Yung pinag-usapan natin last time na in-approve mo.
Of course!
Yes! Yung OSCAR. Basically, this is an abbreviation na ginawa ko to be able to remember ano ba yung 4 causes ng acne. Meron tayong O, which is oiliness. We also have SC, which is skin cells. A, which is acne bacteria. R, meaning redness or inflammation. So maglalagay na lang kami ng parang checklist dito. We'll call it the Oscar checklist para maganda siya. Yes, di ba?
Kasi sino ang winner ng Oscar?
I love it! Naging acting.
Yes.
So, let us start with an anti-acne ingredient, and my reason kung bakit nagko-quotation marks ako. Because I'm not so sure. And this ingredient is over-the-counter retinol.
If you have acne, cosmetic grade is different from medical grade. And retinol is definitely, sabi mo nga, over-the-counter, lahat nandyan. So, it's cosmetic grade kasi it's safe for everyone. I also agree na yung mga patients ko na walang acne and just wants parang moisture, less wrinkles, fine lines, medyo meron namang effect. But for acne, I can say it lacks more evidence to be effective. Especially kung medyo moderate to severe yung acne. So, I don't think it's going to work as acne treatment. But then they can try, pero for sure, hindi rin mag-work. Most probably.
We have heard it being suggested sa social media, Doc. Maraming nagre-recommend ng retinol for tiny bumps or yung closed comedones.
Kasi akala natin comedonal acne is so easy. Di ba? Uy, wala ka naman acne. But mas deadly yung comedonal acne. Kasi nga silent volcano yan. Cosmetic grade retinol for me will not really work. Kumbaga na bilis yung turnover. Pero yun nga, acne is multifactorial. Hindi naman masastop siya ng over-the-counter retinol. If it worked for you, then congratulations. It means medyo very mild yung acne mo. Hindi moderate to severe.
Pag sa Oscar checklist natin, Doc.
Isa lang siya.
Isa lang, SC lang, di ba? And parang half point pa nga lang ata yun, Doc.
Baka hindi pa half 0.005.
0.005. Oh, you heard it from Doc. Yung amount of skin cell turnover that you can get compared to the gold standard acne medications na retinoids. Malayo talaga.
Malayo.
So it's very small. Parang it's just enough to be able to address.
Baka kiniliti mo lang.
Yes. Retinol is not even considered, I think, an acne medication, Doc, di ba?
For anti-aging, maybe it's helping for the moisture.
For the moisture.
Pero acne itself, kung acne-free ka na as maybe maintenance, pero I'm sure babalik ka pa rin ulit sa medical grade.
So it's really more of an ingredient for well-aging. But for acne, you might need something stronger. Ibabalik natin yung 4 rankings. Where would you place it?
I can say, fourth, lacking evidence.
Lacking evidence.
In terms of acne.
So Doc, now that we're on the topic of retinol and retinoids, syempre i-touch on na rin natin yung kapamilya niyang prescription retinoids. So ito Doc, yung mga tretinoin. Ako Doc, I love tretinoin.
Ay, favorite ko yan.
Di ba? We also cannot forget yung adapalene, but we have one na medyo making noise na because of
yung
its...
kid on the block siya.
Yes, it's what we call trifarotene. Bakit mas okay yung mga retinoids na prescription kesa sa over-the-counter retinol?
Kasi it's backed up by studies and clinically sa lahat ng patients ko na naka-maintain on those 3, no feel, happy. So it's treatment and maintenance phase. And although tretinoin is the mother of all retinoids, pero yung side effects niya is not tolerated by many. That's why the next generation, so adapalene, it's more friendly in terms of irritation, redness, and peeling, and can be combined with some topical antibiotics, benzoyl peroxide, kaya parang naging 1 + 1 = 3. Parang synergistic effect. And sa trifarotene, it's one of our favorite. So, very effective and now mas tolerable siya sa skin, even the younger ones.
So compared to retinol talaga, Doc, this one, malakas yung evidence na yun.
Ay, oo. Tsaka, ang layo talaga.
Layo.
Kung nagre-retinol ka, tas na-try mo to, you'll never go back.
Ikaw, Doc, what do you think sa Oscar checklist, ano yung na-address niya?
So, number 1, yung SC, di ba?
Skin cells.
Yeah, kasi parang nagpipeel off talaga din yung
Mas
skin.
mabilis,
So,
yes.
although ngayon micro-peeling na lang yung nice, di ba?
Yes.
And then, it's also, if you combined with benzoyl peroxide, sabi mo nga, so meron din siyang antibacterial properties. Kasi i-combine mo siya with BPO or clindamycin, di ba? And inflammatory, anti-inflammatory din sila.
May anti-inflammatory properties din, Doc. How about Doc? Oil production when it comes to these retinoids?
Very minimal, I can say. So, parang more oil control, more than stopping it, I
More
can
than
say.
stopping
Yeah.
it, I see.
May control sa oil kasi wash out agad yung dead skin. But it's not going to stop your oil glands.
How do you personally determine kung candidate yung person na to ng tretinoin, adapalene, trifarotene?
So first is, I ask and listen, do you have sensitive skin? If they say yes, and I think medyo sensitive nga, so trifarotene. Pero pag talagang mukhang ang oily tapos cystic, and also I do benzoyl peroxide with adapalene. Kung doon na kami sa scar revision phase and willing ng magbakbak to improve the scars, I give tretinoin. Tsaka nag-a-adjust yung skin, di ba? Parang weights. So, initially, low ka muna, weight. So, tas parang wala nang effect, then we can do something stronger. Hanggang pati scars mo, pati marks mo, mabubura. So, medyo intro muna. And then slowly increasing. And dun nga how comedogenic lang, comedones lang, or cystic. And kung parang gusto na ng more challenge sa skin, we decide when you consult. Kasi nga kahit ako, an acne patient, sometimes I use trifarotene kung feeling ko chill na. Pag may malaki yan, benzoyl peroxide plus adapalene. Pero if you want me to revamp my collagen, tretinoin. So, depende rin sa doktor, sa case, and how are you willing to tolerate adverse effects.
So itong prescription retinoids, Doc, where would you put it in our ranking?
Of course, gold!
Yes! Go for gold talaga tayo
Yes, go for
kapag
gold
retinoids. Pero syempre meron din tayong parang fine print sa baba na guided by a dermatologist or used correctly. Pero magandang ingredient talaga ang topical retinoids. Ako, I have been using it. Doc, I'm a proud user of tretinoin for I think more than 4 years already.
Congratulations, you deserve a gold medal. For
Yes.
acne.
So let's move on to the next ingredient, Doc. Ito naman, very, very popular din siya, Doc. This ingredient is niacinamide. Parang may pagka-jack of all trades kasi siya, Doc, in terms of being an ingredient that can help with certain skin conditions based on Yung na-research ko, Doc, parang oiliness ng skin, but also the skin barrier, natutulungan niya yung integrity nito. May konti din daw siyang signs of aging, but also
Pigmentation, di ba?
pigmentation,
Nakaka-help daw.
yes, the
Oo.
brightening effect.
Yeah.
So, ang dami niya talagang benefits, Doc. I think that's why sobrang mabenta siya as an ingredient. But I always tell my audience na jack of all trades siya,
Yeah,
master of none. Sidekick siya dahil doon. How much can it really help with oil regulation, especially compared to other anti-acne ingredients?
Is it from the external or internal? So, I always say, lahat ng pamahid, externally, mawawash out niya yung oil mo from the skin to the pores. Pero pag oily ka from the inside, it means yung pag na-stress ka, bigla mag-oily ka. So, internal din siya, di ba? Or pag hormonal, kahit ilang hilamos ka, oily ka na naman. Maybe somehow it helps, pero hindi significantly to decrease your sebum and acne. Sabi mo nga, best supporting actress siya.
Best supporting actress, but the keyword is supporting. Yes. So ito naman, Doc, I kind of wanted to set it straight na kasi marami sa audience natin kapag gumagamit daw sila ng niacinamide na parang it caused them to purge or it caused an acne breakout sa kanila. Can you really purge with niacinamide, Doc?
Kasi hindi naman talaga siya keratolytic, di ba? So, hindi naman siya nag-increase ng cell turnover.
Pero Oscar checklist muna tayo, Doc. What do you think it can address? Kasi inisip ko since supporting siya, parang wala, 0.001 point for all.
So, ano din, anti-inflammatory siguro because it's an antioxidant,
Yeah.
vitamin B3.
Acne bacteria, definitely no. Wala naman.
So wala siyang antibacterial properties.
Skin cell turnover, actually wala rin.
Wala eh.
Oiliness,
Nag-feel ka ba ever?
Never. From
diba?
niacinamide.
Oo.
And then yung sa oiliness, wala rin masyadong points for that. So, just to set it straight, Doc, saan natin siya ilalagay sa ating ranking?
Not gold, not
Not
second
gold?
line.
Not second line?
So nandun tayo sa
Supporting.
Supporting.
Okay, so ito naman tayo, Doc. Next ingredient. Dati, merong isang sikat na ingredient that comes from nature, di ba?
Yeah.
And this one talaga, favorite ng marami. Feeling ko up to today, meron pa rin gumagamit nito. It is tea tree oil. I read some studies on it. Meron kasing isa. I'm not even sure if it's like a well done na study. Kasi di ba may ganun, Doc?
Yes.
This one, Doc, parang sinasabi nila na yung tea tree oil daw could have the same efficacy as benzoyl peroxide. And syempre, since I guess before, parang yung mga tao iniisip nila, oh, natural siya. Mas
Yeah.
derived from nature. It must be better. Di ba? Minsan pa nga pag natural, you can get an allergy from it. Di ba?
possible. Meron talagang patients na natural, home remedy, oil nga siya eh. Baka pang massage oil pwede pa. Pero hindi pa
Yes.
acne.
Bakit parang...
Hindi siya pang acne. Although medyo may
Antibacterial properties.
Very little. Anti-inflammatory. But for moderate to severe acne, di masyado.
Hindi masyado.
So, parang walang time frame pag organic natural kung kailan ka mag-clear. Unlike pag dun sa gold standard, 6 weeks dapat laking improvement na.
Sa tea tree oil, walang ganong studies na parang 6 weeks lang, ginamit ko
Yeah.
yung tea tree oil, wala ng acne. Buti sana kung meron di ba,
Oo.
Doc? But even as a spot treatment, Doc, for example, meron akong pimple talaga. Would you say tea tree oil is an option or do you think even as a spot treatment, there are better options already?
Oh, definitely, may better options. And minsan yun pa yung mga cause ng mga more severe contact dermatitis, di ba? Yung mga spot treatment na kulang sa evidence. I just gave adapalene and benzoyl peroxide for spot. 1 or 2 days, wala.
Okay, so balik tayo sa Oscar checklist natin, Doc. Oiliness, does tea tree oil do anything?
No.
No? Parang it
Adds
might...
on oiliness pa nga, di ba?
Oo nga, kasi
Oo.
oil siya, di ba? And then SC, skin cells?
Hindi rin.
Parang wala rin. Acne bacteria?
May claim pero very weak.
Very weak, so 0.0001 point.
Yeah.
And then for inflammation, may konti ding anti-inflammatory
konti
properties.
din.
Given the points, ano sa tingin mo,
Yeah,
Doc?
more evidence to treat acne is needed.
Meaning, doon talaga siya sa huli na ranking which is lacking
Lacking
evidence. Ito, Doc, sa journey ko in trying out anti-acne products, ito talaga yung pinaka-prominent. And up to today, it has been part of my skincare routine, one way or another.
Yep.
And this ingredient is salicylic acid. So ito, Doc, marami na siyang types, no? Like salicylic acid cleansers, salicylic acid toners, even sometimes mga salicylic acid soaps. A lot of them say na okay siya for acne-prone skin. And marami siyang studies. Eh, di ba usually kapag ganun, Doc, technically gold standard na siya. I'm not sure lang, Doc, if it's really, kasi hindi naman siya prescription medication. So, how could salicylic acid really help with acne? And ano ba talaga yung sinasabi ng evidence?
Yeah, because salicylic acid is beta hydroxy acid. So, it cleanses up to the pores. So, parang alpha hydroxy acid sa surface. So, ito hanggang sa pores manunuot siya. Kaya may sting di ba?
Yes.
When you use salicylic acid. Although, yung strength niya nga, it varies. Kaya pati sa kulugo, di ba gamot yan? More on keratolytic siya, pang tanggal ng squamous cell. And yung sa Oscar, medyo sinusweep away rin niya yung oil.
Kayang-kaya niya talaga si O.
But
RNU
external.
External.
So, but it's very good with SC.
Skin cells.
Yeah, oo.
Okay.
Keratolytic siya and meron din siyang konting anti-inflammatory.
I see. Okay. Oo nga, Doc. Kasi yung iba ginagamit siya sa spot treatment to prevent the redness of the acne from being too red. How do we guide the consumer in choosing kung alin ba yung pinaka-okay sa kanila?
Okay, so kung medyo sensitive skin ka, kasi nga sa foam wash, little contact, di ba? Kasi you'll wash it away. So kung sensitive skin ka, choose sa wash. Kung medyo resistant naman yung skin mo and very oily, yung maiiwan sa skin. So pwede yung toner. And depende pa rin yun sa concentration ng salicylic acid.
Is salicylic acid considered an acne medication?
Pwede mo siyang gamitin as maintenance.
As maintenance?
Oo. And it will really help dun sa SC and O ng Oscar.
In combination with other anti-acne
Wala
ingredients.
kasing talagang isang gamot lang sa acne
Definitely salicylic acid alone cannot. I'm not sure if it's a gold standard ingredient din So I guess somewhere in the middle. But what do you think, Doc?
It's second line. Baka yung gold standard, Doc, naka-gold standard na ako, medyo ang bagal.
Pang-pa-boost siya, Doc.
Kasi para yung active ingredient pumasok, tanggalin natin yung SC and O, di ba? So, papasok na yung active ingredient agad-agad.
That makes so much sense. Kasi even ako with my own dermatologist, Doc, sabi ko, kasi Doc, nagtetretinoin na ako, nagbe-benzoyl peroxide na ako, but I'm still getting comedones. Tapos sabi niya, nag-exfoliant ka ba? Nagsasalicylic acid ka? So sabi niya, ibalik mo yun because that will help address the comedones again. That's super helpful. That's super helpful for patients who are figuring out nasaan ba yung place nila ng salicylic acid, ng retinoids sa isang routine. Grabe yung pagka-case-to-case basis nito, Doc. Kaya talaga napaka-important to be able to consult with someone like Doc Ailynne who knows when to put it in a routine or when to incorporate it. Okay, moving on sa next ingredient, Doc. Ito naman, for me, Doc, parang best friend siya ni salicylic acid. It's benzoyl peroxide. Never to, Doc, nawala sa routine ko in my 8 years na nagka-acne ako. Benzoyl peroxide has always been there. How often do you use this sa patients mo? Is it non-negotiable na kailangan talaga may benzoyl peroxide? Lahat ng patients mo meron?
Ako kasi sa moderate to severe, kasama talaga yan kasi medyo magic siya, di ba?
Yes.
Instant siya na affect the die down agad. Pero yung risk for hyperpigmentation, ang lakas din. Super effective, pero yun din yung kinoconsider ko na sa hyperpigmentation. Pero kung gusto lang mag-die down, medyo magic, di ba?
Yes.
So, benzoyl peroxide.
Kasi ang ganda din niya, Doc, as a spot treatment.
Yes.
Like parang ang bilis talaga mawala ng inflammation.
Oo. Kaya din may combination of adapalene and benzoyl peroxide. So, yun yung perfect combo talaga.
Meaning, Doc, yung adapalene, pag kinumbine mo with benzoyl, maybe nababalance out niya yung pigmentation.
Oo. So, on its own, I don't really use it, but in combination, definitely.
So, unahin natin ang oiliness. Benzoyl peroxide?
Ang hirap kasing internal or external, di ba? So, external, maybe yes. Keratolytic, yes. Antibacterial, also. Pati yung resistance pala sa antibacterial helps with benzoyl peroxide, di ba? And anti-inflammatory also.
So, in a way, may merit siya for all.
Definitely.
Yes. But it cannot be used alone. Actually, si Doc nga, di ba sabi niya, she prescribes it with adapalene. Yun talaga ang best friend ni benzoyl peroxide mo ka for anti-acne treatments. Where would you place this, Doc, sa ranking?
Definitely gold.
Yes, definitely gold. Inunahan na ako ni Doc talaga, sabi niya, gold. Gold na agad.
Oh,
yes.
gold.
Di ba? Kasi
Puro check
no questions asked talaga. Actually, very curious talaga ako dito, Doc, sa una nating pag-uusapan na may oral version siya. It is oral lactoferrin and zinc. Kasi may supplement ngayon, Doc, na it has both of those ingredients in one capsule. The quality of the studies, parang isa pa lang ata. Tapos parang the conclusion that we had was parang medyo
kailangan
unsure.
pa ng evidence. Ganun ba? Okay.
Yes, parang kailangan pa ng evidence. Pero Doc, very widespread siya sa drugstores. Like when you see it, ano talaga, minamarket talaga siya sa, okay, if you have pimples, okay, take mo lang to tapos mawawala talaga sila. So when it comes to your practice, Doc, meron na ba sa kanilang gumamit ng lactoferrin and what are your thoughts about it?
Marami nang gumamit. Doc, nag-lactoferrin na ako, ganyan. And may pimples pa din ako. Then, it's not working. If you do not have acne now, and you're just bothered na baka magka-acne ka because it's an antioxidant or a supplement, nice to have but will not cure your acne.
Parang hindi talaga siya treatment.
Yun
It's
nga,
just a
sabi nga
supplement.
namin, parang kailangan meron kaming word of honor na in 4 weeks, 6 weeks, you're acne-free. Pag pinatake namin yan, wala kaming ganung yabang. Kasi nga kailan mawawala ang tanong, di ba? Yeah, more evidence
More
is needed.
evidence. Pero when it comes to yung Oscar checklist natin, Doc, what do you think it targets based on the studies that
Possible lang dun sa inflammation. Further studies is needed. Pag-aralan pa natin.
until there's enough evidence, we will go with what is gold standard, di ba? Based on yung sa checklist, isa lang din yung natatarget niya. So, where does it fall sa bottom? Wow! Pero,
Supporting, maybe.
Supporting
for
naman. Okay.
inflammation.
Okay, ito naman, Doc.
Yeah.
Next natin, it's usually used also in treatments but temporarily.
Yeah.
So, keyword temporarily, of course, ano pa ba? But antibiotics. So, ito yung mga clindamycin, yung mga doxycycline, limecycline. Ako, Doc, as someone who's taken them all at one
Me
point
too.
in my life.
Oo.
Ikaw din, Doc?
Oo. Of course, sabi nga natin, gut health is connected to acne. When you take oral antibiotics, yung flora nung gut natin nag-change kasi good and bad bacteria nasi-sweep away. When we take antibiotics, should be limited and prescribed by a doctor kasi hindi naman siya all good. May resistance din, di ba?
Naging
So, pag
resistant.
kailangan lang and don't do it often.
In my experience, it's always been kapag sobrang inflammatory lang nung acne
Yeah.
and something needs to be done as soon as possible, antibiotics.
Yeah, may time ba nasusuka ka rin sa mga antibiotics mo? Kasi may irritation din sila sa gut eh.
Sa akin, Doc, wala. Pero may mga kakilala ko who've taken antibiotics and medyo nagka-stomach upset
Yeah,
sila.
and then yung iba talaga din patients ko, namamaga yung face.
Ah, really, Doc?
Yeah, kasi
Oh my gosh.
meron din allergic reaction sa antibiotics.
Antibiotics.
From the word itself, antibiotic, so yung bacteria nawawala and it has also anti-inflammatory properties. Pero oiliness-wise and yung SC, medyo hindi niya na-address.
So more of the AR.
Yeah, AR.
Acne bacteria and the inflammation. or
Double
the
check
redness.
naman siya doon.
Double check naman siya. Bakit yung antibiotics, Doc? It's important to take it temporarily. Why do we have to stress that to yung mga nagtitake nito?
Resistance. Di ba yung mga bacteria ngayon at magpakailanman, nag-evolve din. So, even antibiotics, baka hindi na sila maging effective later on.
Pag masyadong ginamit.
Yes. And yung gut health na nga natin, kawawa. Kasi the good and bad bacteria will be swept away talaga.
Pero Doc, siguro baka marami mag-worry kasi like if we use it in the short term, oh no, mamamatay yung mga gut bacteria
Yeah.
ko for a few months.
Yeah.
Ayoko na lang mag-antibiotics temporarily.
Ay, hindi pwede naman. Mare-revive naman yung good
Mare-revive.
bacteria.
Do you know any situations na parang nag-misuse sila or masyado silang nag-depend on antibiotics?
Number one, possible wala ng effect. Kaya sa infectious disease, friends ko, hindi na sila isang antibiotic lang. Kaya nga nauso yung tandem agad with antibiotics.
Kasi marami nag-abuse.
Yes.
Kaya talaga short term ang
And prescribe.
and prescribed ang most of all I think prescribed is the number one keyword for antibiotics.
Tsaka
And
hindi lang din bacteria yung acne, di ba? Meron din siyang fungal component. Yung fungus magta-thrive. But we need a balance in our ecosystem.
so pwedeng mag-overgrow yung
Yes,
fungus.
usually ganon. May overgrow of fungus. Kasi dapat balance fungus, bacteria, normal flora. Pag nag-antibiotics kasi good and bad, may over fungus.
Where would you place it sa ating ranking?
Definitely second line.
Alright, ito naman, Doc, another oral medication. When I took this medication, best skin ever in my life. Siya talaga yung acne medication na that really changed the course of my acne and made me a believer of acne medications.
Tingnan mo yung smile mo ngayon, parang obvious na obvious. Na gusto mo
Yes.
na siyang i-gold kahit wala pa man akong opinion.
Yes, kaya I'm sure we are aligned here because this is Isotretinoin.
Yes.
So, marami nagsasabi, Doc, na this is the closest thing we have to a quote-unquote acne cure. How does it work to treat acne?
Sa Oscar, lahat yan. Check na check. And
check siya
this
lahat.
is the only medicine yung shrink yung oil glands mo to zero. So dati sabi ko, control. This one, oil glands, kaya niyang i-shrink. Kaya nga yung mga naka-isotretinoin, Doc, parang lumit yung nose ko. Kasi yung oil glands mo, na-shrink din to zero. So making your bridge more prominent.
Yung oiliness ko was so
Yes.
much controlled. I didn't even think I was oily skin type anymore nung tinatake ko yun. Parang
Yes.
normal na ako.
Oo.
But I think yung pag-shrink ng oil glands, that is also a side effect for other people.
Yeah.
Kung sa akin, it was from oily, naging normal ako, that could mean for those na normal lang yung skin type, baka pwede maging dry sila.
Yeah, so lahat ng patients ko on Isotret, yung lips talaga, I'll check on their lips, yung eyes, minsan dry, or minsan scalp din, or even yung joints parang nag-dry din daw. So, yun yung adverse event. But your skin is nice, normal, pero yun nga rin, yung possible dryness, but very much we can address. Even nosebleed, yun yung concern. Tapos,
Ako rin, Doc. Sobrang na nosebleed ako before.
ka.
Yes.
So, then I do
okay.
lower the dose or adjust accordingly. Doon din yung counseling. Kaya every month akong nagfa-follow up to my patients to know kung may mga ganun silang nafe-feel. But I don't introduce. Sila mismo yung nagsasabi pag may nabasa.
Just so you guys know, the only side effect I probably got from it was yung sa
Nosebleed,
lips
sabi
and
mo?
nagno-nosebleed din 1 or 3 times in my 6-month course.
Okay.
It's not really something to be concerned about for me, Doc. Pero Doc, ang isotretinoin, why is it usually considered a last resort? Ito na nga ang the best. Pero bakit hindi siya ang ginagawa nating, okay, first, isotretinoin, go na yan?
Kasi nga parang something long-term, you have to monitor yung blood works and we have to counsel the patient. Hindi naman siya last resort if the patient came from a scarred family history na, Doc, magsuscar talaga ako at yung daddy ko kasi nag-scar. Tapos,
May pattern na, Doc,
oo,
basically.
or parang, Doc, 10 years na ako may acne, I've tried everything. Yun na yung isotretinoin na yung bibigay ko.
Yung bibigay ka. Because we know already what's going to happen, di ba?
Oo, kasi yun nga, it's harder to treat scars, di ba? Basta monitored ka, you're in good hands, you're with a trusted dermatologist, you're being monitored on a regular basis, no pregnancy allowed pala while taking isotretinoin, and of course, yung healthy lifestyle pa rin. So usually, liver function test, kasi nga long-term siya, cholesterol levels, kasi nga it's vitamin A, oil-based. Check lang natin kung yung triglycerides mo, cholesterol, tumataas. But kung very low dose, most probably kung tumaas sa fast food.
Why is it so important na guided ka by a dermatologist kapag nagtitake ka ng isotret? What could go wrong, basically?
Kasi nga yung lab works mo, bawal pregnancy. Tapos long-term yung iba nagkaka-liver problem kapag hindi guided. So cirrhosis, mga ganyan. We have a dialogue, is it too much for you? Bawasan ba natin?
Kumbaga, Doc, parang controlled yung pag-take nung ganon, nung isotretinoin. Kailangan maingat tayo because we're all leading different lives.
Oo.
Diba? Parang kailangan natin siya i-integrate sa life natin ng mabuti. Kung hindi, baka masira ang buhay natin.
Ay, oo.
Ito ba, Doc, ang isotretinoin? Can it be taken indefinitely? Kasi yung sa akin, Doc, pinastop nung derm ko. So I'm thinking it's something that is temporarily taken only up until maging mild to moderate na lang yung acne mo. Or indefinitely versus certain amount of time lang.
Yeah, it's weight dependent.
Weight dependent.
So I
Okay.
always ask, what's your weight? And we compute the dose. So cumulative din yung effect niya eh. Kaya usually long-term nga siya to achieve the cure.
I'm thinking ito ang ating gold standard
Of
talaga.
course, gold.
Go for gold talaga
Yeah,
tayo.
go for gold talaga tayo.
Alright, next up, Doc. I saved this for last because, kumbaga kung meron tayong Grammys, siya ang best new artist.
Oh.
Talaga. I'd like to know your thoughts, Doc, on Azelaic Acid. Currently, Doc, kasi meron siyang 2 types, diba? Yung pinaprescribe, Doc,
Yeah.
is the 15 to 20%. And then, meron naman din, Doc, ngayon na 10% Azelaic Acid. Ang question ko, Doc, meron pang difference in the prescription versus the over-the-counter percentages that are a bit lower? Kasi parang namimix sila. Na parang pag sinabi mo may benefits ang Azelaic Acid, the studies kasi are nasa prescription. Does that mean...
So over-the-counter applies.
Yes, parang does it apply to that? Or ano bang role niya?
So my only experience for Azelaic is of course yung prescription or medical grade, yung 15% up. So I usually give this to pregnant patients with acne kasi safe nga siya for pregnancy. Meron din siyang merit sa pigmentation and like acne rosacea dun sa mga red
Namumula din dito, Doc.
oo, yung mabilis mamula.
Okay.
So I have really no experience sa mga over-the-counter. Since dun nga tayo sa pa-safe, di ba? Kung sa pregnant, lactating, trying to conceive women. So dun yung studies niya. And medyo may control naman, pero hindi rin talaga cure. So dun sa mga over-the-counter, medyo wala akong experience on their effectivity.
So parang ano siya, Doc? Alternative. Kasi nga, di ba, ang pregnant, bawal mag-retinoids,
Yeah.
bawal mag-isotretinoin. This is the only option. And
Yes.
it just so happened na it can also work on pigmentation, rosacea.
Yeah, oo.
Even for pregnant people, parang that's just an alternative. But eventually, tama ba, Doc? Once manganak na si pregnant, probably pwede na siyang bumalik sa...
After kung maglalactate pa siya, di ba?
Oo.
After nun, pwede na.
Pero Doc, would you say yung Azelaic, for example, ako, meron akong routine with a certain type of acne medications. Do you
So, may
think,
gold standard ka na. Ganon.
yes, may gold
Okay.
standards. Do you think Azelaic can have a place in the routine?
Bakit pa? May gold standard ka na eh.
Oh, okay.
Diba? For pregnant women, they cannot. Parang afford yung risk for the gold standard. That's why I give the second best, which is
Doc,
Azelaic.
Di ba Doc for pigmentation?
Di ba Retinoin can also do it?
Oo nga, Doc, no? So parang meron na, di ba? Like, wow, medyo na-open yung eyes ko, honestly. Sa na to. Kasi parang, bakit pa kung meron na tayong gold standard for pigmentation and can help with the other
Pero
acne
yun nga,
concerns?
kasi tayo parang minsan always wants variety, try
Yes.
something new. Gusto natin ulit ng variety. Yun yung ng human nature. Parang, di ba, gusto natin effective. Pero minsan gusto rin natin mag-try.
Where do you think Azelaic Acid contributes or kung saan kaya siya merong merit?
Kung maganda kasi yung pagka-keratolytic mo, yung oil medyo may control. So, meron din siyang mild antibacterial properties. And kung na-control mo yung tatlong yon, anti-inflammatory. So, 4, pinilit.
Pinilit.
Pero hindi yung all.
Hindi yung masasabi mong confident
100%.
all.
Yeah. Parang
Yes.
50% to all.
I see. So, based on that ranking, where would you put it?
Second line.
Second line.
Yeah.
Kasi nga alternative siya.
Yeah, good alternative to the gold.
Alright, Doc. So, I love it. Ang dami nating na-cover talaga ng mga anti-acne ingredients.
Thank you also kasi yung mga bago, hindi ko talaga alam yung mga yan, yung mga trending. Hindi ko sila alam.
Pero it's nice also that we touched on a lot of them, especially yung mga nagiging ngayon sa TikTok, yung mga favorites nila, para medyo clear na rin tayo. So, ang nakuha ko from this discussion, Doc, is yung mga gold standards natin talaga are the ones that we need to include in our routine or the ones that we at least need to prioritize and consider, especially for those, Doc, na gumagamit na ng mga skincare products with their anti-acne medications.
Non-negotiable yung tawag sa kanila. At yung kung may patients man ako nakikinig dito, sila yung mapapalo kung wala silang ganyan sa skincare nila.
I love it! Namamalo si Doc.
Ay, oo.
Diba?
Mabait ako pero tumitigre din pag hindi sumusunod sa gold.
So itong pinag-uusapan namin, guys, hindi to in the place of an actual derm consultation. This is more of just what to prioritize kapag meron ka na ng mga products na to and nag-consult ka na talaga with your dermatologist. Parang at the end of the day talaga, you still need to consult with a board-certified dermatologist for you to be able to find yung tamang set of acne medications that is tailor-fit talaga to the type of acne that you have, yung skin type mo, etc., etc. And of course, for those who want to consult with a board-certified dermatologist, syempre, nandito na si Doc, di ba? Especially for those who are in San Fernando, Pampanga, na ando ng VW Clinic. Pero recently, Doc, nalaman ko na you guys also do online consultations.
Yeah.
Di ba?
So that we can cater to more who wants gold for their skin.
Yes. And for those who want to consult with Doc Ailynne, meron akong gift para sa inyo. Actually, gift natin.
Yes.
Para sa kanila, itong mahiwagang QR code na ibibigay namin. And this one will give you a discount on VW Dermatology services, consultation, treatment, yung mga procedures that you will have in the clinic kung magvivisit kayo. Meron kayong discount or you can also use my code JanAngelo25. And with that being said, Doc Ailynne, thank you so much.
Thank you.
It was such a pleasure to have you again sa channel. As in talaga.
My pleasure, always.
Di ba, Doc? Super exciting to have you here always. And I hope natulungan kayo ni Doc Ailynne. But if you also want to connect with Doc Ailynne sa social media niya, she's also pretty active. We'll be leaving yung ibang mga socials ni Doc Ailynne, her Instagram, etc. sa description box again if you want to follow her. And also, if you want more videos with me and Doc Ailynne, let us know in the comments also. Let us know kung ano yung gusto nyong pag-usapan namin. And as usual, guys, thank you so much for watching. Maglalagay pa ako ng more videos here just in case you want more videos with dermatologists na in-interview ko sila. And as per usual, I will see you in the next video. Bye!
Bye.